Welcome to the Empowered Birth Series, where I go deep into everything that you need to know to plan and get your true empowered natural birth. And today we are talking all about due dates. If you've been following along with this series, then you know I'm going deep into the 26 things that you need to know if this is your first time planning a true natural birth. And number 13 on our list is that your due date is a guess date. So, you know, we really have a lot of focus in our culture on the due date. If you go to 40 weeks, you are suddenly on the clock to have your baby before they need to induce you. And before you hit 40 weeks, you are constantly trying to get into labor before this magic date. But what does this really mean? Today, I'm going to be giving you some hard and cold truths, not facts, truths. Because the reality is that there's no such thing as facts. If you've ever seen the movie Inside Out, there's a scene where Joy is basically saying these facts and opinions all look the same. And they all got mixed up when they were on this train of thought. And they're like, all these facts and opinions all look the same because it's true. All opinions and facts are still basically the same thing, because even data and evidence can be skewed or interpreted a different way. So, as an empowered mom, I just want to remind you that you are your own best expert. And I talk about this inside my book, Your Empowered Birth. I say how experts can get it wrong too. And if you are looking to somebody else to guide you to a true natural birth, rather than really focusing on the one person that truly matters, you are more likely to get taken somewhere you didn't intend to go. I call this the fast food restaurant dilemma, which again, you can read more about inside my book, Your Empowered Birth. You can also go to the playlist on my YouTube channel where I read out the entire book to you. But basically, you're craving a 5-star steak at a restaurant and you have never been in this area. Like, you're new to the area, but you're craving a 5-star steak. You've heard that there's a really good restaurant in the area, but nobody seems to know how to get there. And then somebody's like, I know how to get there. I'll take you there. And rather than question it, rather than ask them to give you the map so that you could figure it out for yourself, they just say that they'll take you straight there. And you get in the car and you're asking questions, but they tell you not to worry your pretty little head about it, and that they'll take care of everything. And you just sit back and relax. No, you don't need to question. Yeah, I know it looks like we're going in the wrong direction, but trust me, we're going in the right direction. And then suddenly you wind up at a fast food restaurant. And you're like, what the hell? I told you I wanted to go to the steakhouse. They're like, yeah, I know, but that steakhouse is kind of tricky to find. And it's not that great. I mean, this is just as good. Besides, you're really, really hungry. So I just figured this would be just as good. And you're just supposed to be happy with that. Because, a full belly is all that really matters, right? Never mind the fact that you were craving the steak or whatever it is that you're craving. You've been fed. Substitute for your most favorite meal, the one that has your mouth just watering. And then think about how disappointed you'd be if somebody said that they were going to take you to that place and then they ended up taking you somewhere else to get just anything. How freaking disappointed would you be? Well, this is what happens when you listen to the typical information and advice about due dates and induction and how to have a healthy baby. And I'm just done with it. I'm just done with it. So I'm going to give you the truth about due dates so you don't get tricked into an induction and you don't fall for a lot of the crap that the medical system says. So strap in, because this is going to be the best education that you could possibly get on due dates. And if you want to go for the deeper dive, go get In Your Own Time by Dr. Sarah Wickham, because I'm pulling right from her book. Okay? So the first thing you need to know about due dates is that they're completely made up. Yep, you heard me. Due dates are completely made up. They are arbitrary. They don't apply to everyone in the population. And in fact, only 1 in 20 moms will actually give birth on her own on her due date. When you recognize that, you might be asking, well, if that's the case, then why does everybody say that the due date matters? Well, as a society, we really don't like to wait for things, and we don't like things that are unpredictable. And we really have this mentality that if something doesn't come at a certain point, that we need to rush it. This is one of the problems in our culture right now, is that if you are not following what everybody else says you're supposed to do, or you're not doing it at the pace that everyone thinks that you should be doing it at, well, then there's something wrong with you. Instead of questioning the system and instead of questioning the data, we instead question the mom. But what if we stop doing that? What if we recognize this truth, that due dates are completely made up? There was a philosopher, you may have heard of him, Aristotle. He came up with the idea that a woman's pregnancy lasts around 10 lunar months. This was an observation, and, he's a man and he observed things and he just automatically made a conclusion about it. And then somehow a whole bunch of other men, because in the universities it was all men, you have to remember that, it was all men. They all gathered around and they all took Aristotle's observation and they're like, oh, yeah, that makes sense. Yeah, now this thing that we don't quite understand, we can understand it in a manly way. Okay, so 10 lunar months, got it. And then they made that a rule. Meanwhile, the women were probably looking at it as like, these stupid boys, like unbelievable. Do you know what my husband did? He said this. Oh, are you kidding me? He really said that? Yeah, but we're not supposed to question them, right? Oh, no, of course not. Because, they're men. They know more than us. What are we? We are just women. Our bodies are defective. Did he really say that? Oh, yes, he totally said that. He actually said that a woman's body is a defective man's body. What a sexist prick. Well, I mean, yeah, but it's at least they can't control it, right? Oh, yeah, that's true. I mean, we can always just say that the baby was a little bit late, or maybe baby needed to grow a little bit faster or a little bit slower. And like, they don't know. We can lie about when our last menstrual period is. They don't know anything. I mean, men don't know a thing about our bodies. Well, that's true. At least they can't control us. But then we go all the way to 1709. And there is a Dutch doctor. And recognizing that in 1709, women still did not have very many rights, we were still technically considered property. If a woman spoke out of turn, she would be branded a witch. So we have this long, long history of women who have had their rights slowly chipped away at, and women not being taken seriously, and women being treated as property. Now this Dutch doctor shows up, and his name was like Boerhaave or something like that. It's really hard to pronounce. Herman Boerhaave proposed an algorithm or a set of rules which would estimate the date of birth. So he did that by adding 7 days and 9 months to the date of the woman's last menstrual period. But there is a suggestion that the measurement of gestational length has legal rather than medical roots. Of course it does. Doctors were called upon to decide whether the time that had elapsed between sex and birth could positively establish paternity. This shows how women weren't listened to or believed then either. No kidding. Doctors could override a woman's knowledge and declare whether a particular man might or might not be the father of her baby. As you might imagine, the medical men's pronouncements weren't always truthful, especially if they were bribed by the alleged father. So if you're looking at that, maybe they had a situation where the woman was claiming, I did not get pregnant by my husband. I actually got pregnant by this king, but because I had a daughter, he's not acknowledging this child, and I want to have some help with that. Or maybe it was like a noble family, or maybe it was the other direction where a woman was trying to get out of an arranged marriage with someone she didn't want. And so she deliberately got pregnant before the wedding, knowing that she could say, well, I've been ruined, so this child's not yours, and you're going to have to annul the marriage so I can marry the man I truly want. I don't care if I lose social standing, because now I can be with the one I really want. And instead, the rich man who wanted the wife will say, well, I'll claim that child as mine anyway, because it's a girl child. So I don't care. I'm just going to have my heir anyway. And then this one will just be passed on to some man that I am doing business with. Like, think about it. Think about the implications of being able to bribe another doctor, bribe them and say, you keep quiet about this so that I have control. Or you keep quiet about the fact that I'm actually the father of this child because it's going to ruin me. Being able to do that, and women were not believed, you better believe that was a powerful thing to do, especially back in 1709. The other thing that you need to understand about this is that the writers of the obstetric textbooks decided it should be on the first day of the last menstrual period. But the original way that they were trying to figure out these dates, they didn't specify if it was the first or the last day. And it's like, oh, it's the first day of the last menstrual period. But our cycles alter. Sometimes it's 7 days. Sometimes our period ends at day 5. Sometimes we have a longer cycle than 7 days. Like, who knows? How can we really be sure when the last day of our last menstrual period was? And like, we started, okay. Well, again, our cycles can vary. So the other thing that happened after this Dutch doctor first came up with the idea of the due date, this algorithm was then reported by Franz Karl Nagel and renamed Nagel's rule. And this is the basis of how we have come up with the due date and the last menstrual period. Here's the problem with that. Over the years, research has shown that Nagel's rule doesn't accurately reflect the average length of pregnancy. No kidding. Few small, older studies found that the average length of pregnancy was a few days longer than Nagel's rule predicts. And a later, larger study confirmed that the median average length of pregnancy, or the point of which half of all women had given birth, was 40 weeks and 5 days. So that's the median. So that's right in the middle. That's not the average. The average gestation is more like 41 weeks and 3 days, especially for a first-time mom. So the research also found that there was a considerable variation in the lengths of pregnancy. And this was even true when the conception date was known. So when you really understand this, just how much this was made up, like we went all the way back from Aristotle, one day just deciding, I have observed that pregnancy lasts 10 lunar months. And no women were able to really contradict him because he was sitting there in a university lecture space talking to the other men there. And the men all agreed with him that this was a good idea. And the women were probably sitting there shaking their heads, but they can't say anything. A lot of them were not able to read and write. They weren't allowed to speak their minds, but they were secretly still performing as midwives to be able to support birth. And pregnancy and birth was passed on through oral tradition with women. But then we get to the 1700s. And now we've got this Dutch doctor, and we've got even more restrictions. In the 1700s, birth was also no longer being the space for women. They had brought in physicians. So in the most affluent households, They now had doctors coming in. And the gossips that used to be at the birth, consisting of the mother and the friends and the aunts and the cousins and maybe even some daughters, like when it was a family affair with all of the women surrounding this other mother who was giving birth, when they got rid of the gossips, a lot of that knowledge was lost. This is also when birth started to become more of a medical event, because these doctors were now thinking that birth needs to be more efficient. So they invented tools for efficiency, and they still didn't have the ability to induce. So at this point, they still didn't have that ability to induce. And then Nagel comes along and he comes up with the idea of the due date. But again, up to the 70s, they still did not induce labor. Like they didn't have the ability to do that. If they tried to induce labor, it was usually through some natural means that come up with all those old wives' tales. Like there was probably castor oil, but even still, that didn't guarantee that the baby would come out. And then we suddenly discover Pitocin, and we run into a whole bunch of troubles. And I did an interview with another mom who told me all about Pitocin. She was also a nurse at one point. She was a nurse clinician, and she told me about what had happened where there had been a French study. So this was written in French, where the doctor had said, I've discovered something. It's really dangerous. We probably shouldn't use it to induce labor. And then somebody else was like, hey, we can now control the timing of birth. This is powerful. Let's use it. Now we can control birth. Before we couldn't control this, now we can control it. So somebody else discovered it and they're like, this is too dangerous to be using. And then somebody else is like, oh, but look at the opportunity here. We can now time this. We can now control this. We can make it happen on our timeline, not theirs. So recognizing that a lot of the reason why the due date came out in the first place was based on patriarchy. It was based on the idea of establishing paternity and controlling for the precious progeny. And I call this precious progeny syndrome because really what they're focused on is the baby, and the mother was the wrapper. I can always go get another wife, but I need my precious progeny, especially if it's a boy. So they had a vested interest to have that baby be born and have that baby be healthy, but they didn't care about the mother. I mean, she's just chattel. She's just a broodmare. And get rid of her. We just have the baby. We just need an heir. Like when you really understand the social implications and the cultural background and all of the misogyny that was built up around this, you can really go deep in this. And one of the books I recommend for that is Reclaiming Childbirth as a Rite of Passage by Rachel Reed. It's absolutely fascinating. Millie Hill's book, Give Birth Like a Feminist, also goes into a little bit of that and tells you about what's really going on in our birth culture, because this is a issue for women, for us to be able to take our power back. You don't need to be a slave to this arbitrary date. Now, you might be wondering, well, how do you know about your actual due date? Because, due dates are here to stay, unfortunately, until we can shift things. They are here, and we need to work around that. So, what does the information actually say? Well, that leads into number 2, that it's a variation. Due dates are so varied. When you actually give birth to the time of your actual conception, it's so varied that we really should not have a specific date, but more like a due month or a range. And there's a lot of midwives that will look at it, it's like, well, it's within a 3-week window, and some are even more generous, and it's a 4-week window. So even with a known conception date, The median window, as I said, is 40 weeks and 5 days. And 70% of the population will give birth within 280 days plus or minus 10 days from the last menstrual period. 70%. That means 30% of pregnancies, moms don't give birth within that timeline. They'll either give birth earlier than 290 days or they'll give birth later than 290 days. And because we are also looking at pregnancy based on ovulation cycles, your cycle can change even if you are typically regular. You could have a normal 29-day cycle, and then 1 month you could just happen to have a 31-day cycle. And you won't know it until you complete that menstrual cycle. But what if you suddenly get pregnant between those menstrual cycles? There have been cases, and I have even discovered this myself personally, that you just have a really short menstrual cycle, and then suddenly you have another menstrual cycle, and then you have the normal menstrual cycle again. And this doesn't mean that you're infertile, and this doesn't mean that there's something wrong with you. Sometimes there's just things that change in nature, and we don't always know why it happens. But if you do want to go deeper into this, there's something called a pink moon, purple moon, a white moon, and a red moon cycle. And this ties into the phases of the moon. And wherever you fall in that range, there's certain things that you're tapping into. So we don't all menstruate at 28 days, and we don't all consistently have the same menstrual cycle for the whole course of our lives. We can fluctuate. You can be a pink moon, a white moon, a red moon, or a purple moon. You could have a cycle that is about 25 days long. You can have a cycle that is 28 days long. You can have a cycle that's 29 days long. You can have a cycle that's suddenly 33 days long, sometimes even 35 days long. And this can vary depending on what's going on in your life. And if you were consistently at day 29, but your current menstrual cycle, when you got pregnant, you actually ended up ovulating early, well, that affects things because you're like, well, I thought that my last menstrual period was here, but you ovulate early. Now baby might come a little bit earlier than what your estimated due date is. Or maybe baby's coming late because you had a later menstrual cycle and a later ovulation date. You're not ovulating on day 14, you're ovulating on day 18. But the menstrual cycle that you typically had said 28 days. Except for the month that you got pregnant, that's not what your body was doing. So you see where the problem is. It's too arbitrary, and there's too many variations to really predict this. And you can read more about that inside In Your Own Time by Dr. Sarah Wickham in the section that says normality is a range. It's kind of in the middle of the book. So you might be wondering, okay, if I can't go by my due date, and I can't go by my last menstrual period and conception date, well, what about ultrasound? Glad you asked that question. Because the truth is that even ultrasounds cannot predict your due date. It is still inaccurate. In fact, after reading through In Your Own Time and understanding this in my own experience of how things went with my first pregnancy, I can confidently tell you that ultrasounds are really terrible at guessing not only the due date, but also if your baby is growing at the right pace and if they actually need to be induced. Because I was measuring 2 weeks behind for what my estimated due date was. I did end up having my son at 41 weeks. However, they said that his growth was in the second percentile and that he was 2 weeks behind in where he was supposed to be when I was 35 weeks. Turns out that kid was almost 8 pounds when he was born. So this ties into what Dr. Sarah Wickham says inside In Your Own Time on ultrasounds. So when there were studies comparing about the actual date of birth versus the ultrasounds and estimated due date, they found that only 5% of babies that had that estimated due date were born on that date, which is what we already discussed earlier about the 1 in 20. The other thing they discovered is that 66% of babies were born either plus or minus 7 days from their estimated due date. So if you've only got 5% of babies that are born on their due date based on the ultrasound, you have 66% of the population of mothers that are either giving birth 7 days after their estimated due date or 7 days before their estimated due date. So 39 weeks to 41 weeks, basically. So when you look at that, that's still 66%. 30 to 34% of the population of women are giving birth either before that estimated due date, more than 7 days. So we're looking at like 37 weeks to 39 weeks. Or we're looking at the other side. They're giving birth after 41 weeks. 30 to 34% of the population is giving birth after 41 weeks or before 39 weeks. And we're inducing at 39 weeks and 40 weeks. And we're pushing induction by 41 weeks. When 30 to 34% of the population is more likely to go over the 41 weeks or go under 39 weeks. Make it make sense, people. And the reason why the estimated due date is inaccurate, Sarah goes into this as well. She says, one reason for ultrasound dating being inaccurate for about a third of women is because there is variation in growth of babies in utero. This shouldn't surprise us. There's a variation in the growth and size of 2-month-olds, 5-year-olds, and 17-year-olds. And during a woman's pregnancy, when you're measuring tiny distances on a screen that's projecting an image picked up by ultrasound waves traveling through her body, you're not always going to get it right. Technology is limited and machines aren't infallible. So you need to recognize that. She also goes a little bit into the topic of IVF. She says the fact that normal growth is a range that can lead to errors in estimation was confirmed by a Swedish study. Researchers looked at the growth of babies in utero who had been conceived by IVF, so they would know exactly when conception took place. They measured the babies by ultrasound at different stages of pregnancy so they could see if the ultrasound estimates of their age accurately reflected their actual age. For the most part, the ultrasound estimates of the baby's age matched with their actual age, but there wasn't a good match in every case. For some women, there is more likelihood of an error if ultrasound is used to predict a due date. There's deviations that exist which can indicate that ultrasound underestimates the age of a fetus that will be born small for gestational age when the woman is obese, is what one of the studies said. They also found that some groups of women are more likely to be affected by ultrasound dating errors. So their research showed us who is more likely to have their due date changed to an earlier date by ultrasound because their baby is bigger than the last menstrual period date suggests it should be. Some are more likely to have their due date put back to a later date because baby is smaller than expected. So the women most likely to have their due date made earlier because their baby was larger than expected are those with a body mass index of 40 kilograms or higher. But larger women aren't alone in being affected by this. So there's other factors such as diabetes, young maternal age, having multiple births, so multiparity. So if you had more than one baby before, body mass index between 30 and 39.9 kilograms, or 18.5 kilograms, a history of gestational diabetes, a female baby, shorter stature. So if you're short, a history of preeclampsia, smoking, or unemployment. I mean, if you're healthy, but you happen to be very tiny or short, expect that your baby is not going to fit into that range. So then what it said in total is that more than 1 in 6 women were found to have a due date discrepancy of more than a week when the ultrasound date is calculated after a last menstrual period date has been assigned. And some women had a discrepancy of 20 days. So understanding this, you really recognize that due dates are completely arbitrary. Due dates are made up. Due dates do not accurately reflect about 30 to 34% of the population. Due dates do not really predict when a baby is going to be born. Due dates cannot predict the size of a baby when they're going to be born. Due dates also basically put you in this category of not going into labor on time when it's based off of a menstrual cycle that varies and varies even in the same moms. So even if you're used to having a 28-day cycle, you could have an off month. And finally, you need to be able to recognize that due dates cannot be predicted by the ultrasound. So now the question is, how do we get around this? Okay, so I'm just going to give this to you really quick. First of all, if your care provider gives you a due date, you take that with a grain of salt. Make sure that they're the care provider that is also going to respect the range, not to be focused on that due date, but instead see it as just like a central thing that is orbiting around all these other possibilities. So it's like, here, I'm going to pinpoint it that this is the estimated due date, and it can go 4 weeks this way and 4 weeks that way. And if we go past 4 weeks in the later gestation, then maybe we can talk about doing something if you really want to do that. But you know what? There are moms who've even given birth at 45 weeks with no problems. Because again, we're looking at 30 to 34% of the population that gives birth after 41 weeks. And when you really look at that scale, and you're recognizing that you might not fit in that box, well, then that fear of the due date kind of goes away, doesn't it? So make sure you hire a care provider who is going to respect that the due date is a guess date and is not going to push induction on you. And the second thing you can do is what I already mentioned in another video when I talked about people that want to come into your birth space and what you can do to avoid the frustrations of the have you had the baby yet crowd, or the I want to come see the baby as soon as it's out of you crowd. You just don't tell anybody your due date. If your due date is, for example, at the end of March, you tell them that your due date is actually in the middle of April. And then let them do the mental gymnastics to figure out that you either had a really tiny early baby or a really big early baby, or you just lied about your due date so that they wouldn't get up in your face. And of course, I do highly, highly recommend that you read this book in your own time, because it is just a wealth of information on what you need to know to avoid an induction. Because that's really why we want to focus on the due date. We're trying to avoid getting induced, right? We're trying to make sure that the medical system doesn't push you down the path of medicalized birth when it doesn't need to happen. So the more you understand about your due date, the more you have the power. So to recap, due dates are completely arbitrary. They mean nothing. Due dates also do not reflect our overall population, and due dates also cannot be predicted by ultrasound. And if you want to know more, if you want to go deeper into making decisions around induction or anything else that you need support with, you can always reach out to me, hello@empoweringmomsbirth.com, or better yet, go read the Empowered Birth Start Guide. You just go to empoweringmomsbirth.com/start guide. I go into all of the things you need to know about true natural birth, what it is, how to distinguish it from what the medical system teaches. I go into the empowered birth method to help you to have that true natural birth. I give you the overview of how to actually apply that method. Then I also tell you about the 3 paths to working with me, one of them being completely free. And in fact, you're doing it right now, the do-it-yourself path. All you have to do is like, share, and subscribe to this channel. Keep following all of these videos. And all I ask in return is that you pay it forward. Pass this on to other moms who need it. If you're in a mom group right now and people are asking about the due dates, I would appreciate it if you dropped this video, because so many people just focus on the surface level. This one really goes into the details and will help somebody avoid that pressure to induce. It is my greatest wish that I get to go into the mom group someday and I won't see those fearful questions about moms not wanting to induce, but feeling the pressure because they're already approaching their due date. Nothing seems to be happening and they don't want to induce, but the medical system is saying that they're now getting to the point where they're overdue. I don't want to see that anymore because it's not helping anyone. It's causing more pain, more frustration, more trauma, and more C-sections that don't need to happen. And moms are being robbed of their experience, and that's not okay with me. So if you are finding value in this video, please pay it forward. And if you want to know more about how the empowered birth method can work for you, all you have to do is go to empoweringmomsbirth.com/start guide, and that will get you started. Thank you so much for watching. Happy empowered birth journey, and I'll talk to you soon. Namaste.